couple of weeks ago, more than 70 children died at the BRD Medical College Hospital in Gorakhpur.
According to authorities, apart from the lack of oxygen, there were various illnesses that might have caused these children to die. One major cause being a condition called encephalitis.
Doctors on Call today looks into what is encephalitis and what is this all about. I'm Dr. Sameer Gupta.
And I'm Dr. Sonia Lal Gupta, and welcome to Doctors on Call. Encephalitis is inflammation or swelling of the brain. It is caused due to infection of the brain that is usually due to a virus. Encephalitis usually starts with a fever, headache, nausea and body aches. As the condition progresses, it can cause a decreased level of consciousness or increased sleepiness, confusion and seizures. In young children less than 1 year of age, symptoms also include poor feeding and irritability. In severe cases, patients may require the help of a breathing tube that is attached to a machine called the ventilator. This ventilator helps in breathing by providing oxygen. Some common virus infections causing encephalitis are the varicella zoster virus, the West Nile virus infection, enterovirus and Japanese encephalitis virus. The Japanese encephalitis virus is the infection that had infected children in Gorakhpur. This particular virus is spread through mosquito bites. Other viruses, depending on the type, can also spread through person-to-person contact. To diagnose someone with encephalitis, one important test is doing a lumbar puncture or spinal tap.
In this test, the doctor puts a thin needle into the lower back and removes a small amount of spinal fluid. Spinal fluid is the fluid that surrounds the brain and spinal cord. This fluid is then sent for testing. There are some blood tests and also an MRI or CT scan of the brain. The treatment for encephalitis is mainly antiviral medications and supportive care like fluids and medicines to keep the fever down. Encephalitis is rarely life-threatening, but babies and young children are at a higher risk of complications, including death.
Timely diagnosis and treatment are most important to help prevent complications like difficulty breathing and going into a coma.
Practice good hygiene, avoid mosquito bites, and make sure your vaccinations are up to date to prevent this and other infections.
That's all for now. See you next week on another episode of Doctors on Call.